Welcome to this short video outlining our vision and ambitions for our residents for the next 5 years and beyond in the form of a community plan developed through a group of people who meet together as the 2020 board. Despite the financial and demographic pressures facing the council, its partners and its residents, we are all committed to working together to have a shared vision and ambition for all our residents in the East Riding. The plan sets out a picture of the East Riding, its people, places and environment, and what we are doing together to improve the quality of life for us all. I hope this video will show how we and our partner organisations will be working together, contributing to the new community plan.
The East Riding is a highly desirable place to live. It has a unique identity and character, embracing coastal resorts, market towns, large and small villages and a significant inland port. It has a growing population, currently at 337,000, a higher proportion of which is older than the national average. A growing population does though present its challenges, not least in making sure that there's suitable and affordable housing to meet everyone's needs. Whilst crime rates are low and many people enjoy a good quality of life, some parts of the East Riding experience deprivation and disadvantage, with high levels of unemployment, low skill levels and poor educational attainment. This, in turn, can contribute to poor health. Our diverse economy remains dependent on small businesses, a limited number of major employers and the public sector. The public sector across the East Riding is facing major changes as budgets continue to reduce whilst demand for many services increases. For example, the number of older East Riding residents estimated to have one or more long-term conditions is projected to increase significantly over the next 2 decades. To meet this challenge, technology is being used to better target and deliver services. Public sector organisations are working together with other sectors to transform the way they deliver services. Focusing on the needs of the area, the East Riding 2020 board is working towards its agreed ambition set out in the community plan. Children and young people are happy, healthy, confident, safe and resilient to reach their full potential. Older people enjoy a healthy, independent lifestyle. Communities are healthy, thriving, prosperous and safe. Regeneration transforms deprived areas and reduces health and other inequalities. The built and natural environment is protected through sustainable development and economic growth.
So we have a major role as part of the community plan, working with our partners, looking at how we improve outcomes for the population of the East Riding of Yorkshire. The kind of things that we're looking at is trying to help people to empower them, and that's more than just looking at their particular medical or health needs. That's the whole needs of that individual. So how we deal with issues like loneliness, isolation, deprivation, which really requires us to work with our system partners to achieve that.
The opportunity for us to come together, but most importantly is to see what others are producing so we can afford some assistance and resources and teamwork to address some of the ambitions.
We've got enormous financial challenges across all the partners. We're having reductions in funding from central government. We ourselves estimate we've got about 60 million of savings to find over the next 4 or 5 years.
Challenges for us will be improving our services while trying to get costs down. This is a key one for us. Trying to support and create a more digital approach for our customers, so that will enable our customers to have access to IT across a whole host of different platforms.
In terms of how I'm managing my current challenges, it's about ensuring the 2020 board and all my partners are kept updated with the changes. We are nationally investing in better IT to make us more efficient and much more innovative ways of working.
We've encouraged the NHS Emotional Wellbeing Service to come into our offices. So they're now working with our customers. They come in once a month into the East Riding job centres, and they give an initial support and advice on emotional well-being, with the hope that it will eventually trigger them into being in a better place, and then moving them closer to or into employment as its ultimate aim.
absolutely essential to focus on some of the key issues. Early intervention and understanding the needs of the public at the earliest opportunity. We know that the precursors to committing crime and antisocial behaviour are very different. These are affected both by health, education, as well as aspects of social needing, social care. The police, from a police perspective, we want to work with partners in order to understand those and intervene at the earliest opportunity in order to prevent crime happening and reduce our victims. And when we do have a victim, work together in order to put the victim at the heart of what we do.
Clearly we work very closely with all our, and particularly public sector partners, but the voluntary sector and our sort of key suppliers and contractors. Really, we work together to deliver both the ambitions within the community plan and the council's priorities. And we're working very closely really to integrate our services, join our services together so that we're delivering a better service for people.
It has been a real strength in the East Riding, the commitment that partners from all agencies, all public sector agencies and the local authority and council has shown to the community plan and working together. I think it's a real success story for the East Riding. We've got a good track record and I believe the foundations are firmly in place for us to be able to move on and achieve the greater efficiencies that we'll all be required to do in order to be able to evidence effective working practices but also value for money, and that's really important for the public purse.